All right, it's going to be a short video. Stick with us for the whole thing. We're going to talk about Trazodone in breastfeeding. I'm Dr. Nichelle Haynes.
I'm Dr. Kristin Lasseter.
And we're Medical Wellness. This is your place for evidence-based information about your reproductive mental health.
Meaning we talk about mental health in relation to reproductive hormone changes like around pregnancy, postpartum, breastfeeding, menopause, premenstrual disorders, and infertility.
All right, here we go. Don't blink or you might miss the whole summation.
So true.
Okay, Trazodone and breastfeeding. Okay, we can start the conversation with treating insomnia during the postpartum period comes with difficult nuances, right? You don't want to sedate someone so much that they can't wake up for their baby if they need to, or you want to be careful about supporting someone in breastfeeding if they want to, and there's lots of other things that we consider. But if we're considering Trazodone in breastfeeding, what do we talk about?
There, I think, have been 3 case reports of babies who have been exposed to Trazodone through breast milk. And the good news is none of them had any adverse effects. I think one of them they looked at more like long-term, and he or she wasn't any different from other babies. But again, that's 3, so that's not enough to actually definitively tell us anything about whether or not this increases adverse effects in babies.
Do we have information about relative infant dose? I don't know it.
I don't think so. I think there was one study that looked at that for like one breastfeeding person.
Yeah.
So, I mean, no. So we also don't really have the relative infant dose that I know of. But overall, it's secreted in low levels in the breast milk from a few studies.
Yeah, and if we don't have relative infant dose, we can look at other things like size or protein binding and all of that. I don't even know if we have that data.
Yeah, I don't know either.
Yeah.
But it's important to treat insomnia postpartum because mental health and sleep are very important. They go together. If you're not getting good sleep, you're probably not going to have good mental health. And postpartum, we know that it's even more important because you have to be so efficient with your sleep because you don't get a lot of time to actually sleep.
Wow.
Yeah. And I will add that getting 4 to 5 hours of uninterrupted sleep postpartum is like crucial.
Yeah, and then we're aiming for 7 hours in a 24-hour period. Aiming. We know that it's really hard to get there, especially at first, so yeah. Anyway, we don't have a ton of information about Trazodone. I would definitely talk to your doctor about your options. I will say also, though, that Trazodone is probably, if you're taking it during pregnancy, it's probably more likely to have been more present in a baby's system during pregnancy, like as far as transmission through the placenta, than it is through breast milk, I would say.
Yeah, I wouldn't switch probably to a different medication postpartum.
I'm sorry to interrupt you. We do have a video about Trazodone in pregnancy, so watch that one if you need a little bit more information, but that's all we got. So we're happy to share it with you, and we wish there was more information, but thanks for being here. Please like, comment, subscribe. We'll see you soon.
Bye.